So what is conscious competence? Conscious competence is knowing what it is that you do that makes you competent. You are conscious of your competence. And if we look at a couple of scope guide images, I'm able to deconstruct that image. I know that there are two loops in the sigmoid colon. I know that I need to reduce the size of each loop before resolving them with some clockwise torque. And I know that all the movements need to be done very slowly. And because there are such big loops, I know it's very unstable. Here we have a picture of a scope with the tip in the proximal transverse, and I can see from this image that as the scope comes over the splenic flexure, it comes forward and it's dropping to the patient's left, our right. Now that bit that's coming forward will be very superficial, and unless the patient is very fat, I know that my assistant can get his or her hands under or on the side of that and push it medially, driving the scope forward and towards the hepatic flexure. The final one, slightly more complicated, is we have an end spiral loop here with the tip of the scope in the descending colon. I know that there is no point in trying to resolve this loop until you get the loop in one plane. At the moment it's in two planes. But if you anti-clockwise the loop, the scope, then you can get the scope almost in one plane. And when it's in one plane, you can gently withdraw it, and I know that there's a risk of the scope flopping one way or the other, and that this must be watched for. You can feel it happening, and but if you keep it all in one plane and pull back very slowly, then you will not lose the position. But one thing that will happen as you've resolved the loop is the configuration will look like that 9 times out of 10. And the bit below the angulation there's a lot of colon pleated onto the scope there. There's a lot of weight on the scope. And I know that this is a very unstable position and I have to do everything slowly. So I know all these things and I can explain them, I can deconstruct them. So that's conscious competence. And going back to the example I gave here, actually explaining what's going on there to the trainee in the middle of a procedure such that they can sort it out first time is extremely difficult. Okay, it's quite difficult to explain what's going on there, explain what needs to happen. And sometimes some of us don't talk enough, some talk too much, some are talking and quiet sometimes, but not really listening to the concerns of the trainee. And it will be interesting to see whether you think that in the training episode, the trainer is taking note of what the trainee is saying and vice versa. And as a rule, we prefer a questioning approach to what's going on. And again, I want you to watch this video in a moment and see whether there are questions, and importantly, what happens after the question has been asked. Because it's no good asking a question and then, like nothing happens. But sometimes we move into instructing mode, and that's just telling the person what to do. And again, I want you to watch the video and think, well, is the trainer instructing or are they questioning? And I'm finally just going to talk about taking over the scope, because there was a moment in this video where the trainer grabbed the scope. Not completely off the trainee, but certainly the trainer had his hands on the scope, and it's very interesting to reflect why he did that, all right? So we go through a taking over the scope algorithm, and the trainer should ask his or herself, the first question is, do I know what the problem is, all right? So the second thing is, do I know what the solution is? And then the third thing is, can I explain the solution? Some solutions are easier to explain than others. And has the trainee understood my solution? So I want you guys to be looking at this video and thinking, well, the trainer's told me to do something, but does the trainee understand what the solution is? And were the instructions carried out as agreed? And that's highly relevant in this episode, Hannes, dare I say. And is the technical challenge beyond the skill of the trainee? And that's a very important question. And if you think about the competencies that underpin these things, this is the conscious competence of colonoscopy. You know what the problem is. That's the conscious competence of colonoscopy, or one of the competencies. And this is the competency of instruction. the competency of being able to listen and pay attention to understand what's going on. This is the conscious competency of assessment, and again of assessment. You need to be able to watch what's going on to enable you to make a judgment about those last two things. And again, I'd ask you, when you're watching this video, to ask the question is the trainer watching Hannah's?
There's a connotation. I would have said, what might we have improved, or how could we go about making that better, or what did you have trouble with? So some of the language in terms of the instruction, yes, I have issues with as well.
So just I want to ask you just to explore what I hope you don't mind me doing this, Sharon, but just what Sharon was saying about asking the question she might ask the trainee was, what could I have done to help you overcome that better? Can you just unpick that?
Me?
No, I want. Well. Sorry, can I go? Let's go back to Sharon. We'll give Sharon. Can I give Sharon a chance to? So Sharon. So what? Can I just challenge you on that? So what's the benefit of that, and what might be the drawbacks?
So the benefits are you need to check whether the trainee has got some insight into what the problems were, and if he's got no idea, if he says, well, I've got no idea how you could have helped me, then you have to go back and actually probably fall into a more questioning mode. Whereas if he says, well, what I really would have liked you to do is stop me, explain exactly what you thought was going on, giving me some instruction, and then allowed me to do it, that would be a helpful way of understanding what it was that the trainee wants from the trainer. Yeah. And that should really have been covered before the training episode. Sure. We don't know.
Sure. We haven't gone into setting up the educational contracts and everything. And what Sharon's referring to here is it's a good idea to have a prior conversation with the trainee to have some ground rules and try and align objectives. But I suppose where I would challenge you and be interested in your response is that the trainee may not be able to articulate what the trainer, all they know is that it just didn't work for them, and they're not really thinking about how the trainer could have helped them. They're just thinking about how they've messed it up. So is there a better way to approach that, do you think?
Well, I'm going on the basis that you said that Hannes is an experienced endoscopist. Somebody who's done 1,000 colonoscopies is an experienced endoscopist.
Okay.
And knows his trainer very well. So on that base, I mean, I take your point exactly. The more junior or less experienced, or the newer the problem, yes, the trainee might not have the ability to ask for that.
Can I think that's you've given people, I think, an insight into the challenges of debriefing. My own preference, Sharon, is just to ask a very open question about how did that go, and then just follow the lead on the trainee. And if they'd said it was absolutely fine and it wasn't fine, then we have a problem there.